You're listening to the Veterinary Innovation Podcast.
You're listening to the Veterinary Innovation Podcast. My name is Sean Wilkie, and along with my awesome co-host, we interview the innovators in this space every week. Ivan, please go ahead and get us started.
Hi, I'm Ivan Zach, and I'm very excited to introduce today's guest. I feel like we met before, but maybe because I met her husband before. Her name is Christina Lopes, and she is here to tell us about incredible work she's been doing the last couple of years, actually together with her husband. Her bio is she is a CEO and founder of the One Health Company. She holds a master's degrees in international affairs, development economics, and international development from Columbia University. She has doctoral coursework in philosophy and pragmatism from Princeton University and BA in English and literature from the University of Massachusetts, Boston. A couple fun facts. She previously served as a consultant to the United Nations. She has two daughters with her husband and the co-founder, Ben Lewis, and they've been traveling with these kids starting from the Y Combinator when they started this business. So why don't we start with that? Tell us, how did you accomplish to build what you've built with two kids? And you told us that they were part of Y Combinator. Is that correct?
Yeah. So, I mean, for the wider audience, Y Combinator is probably one of the top, if not the top accelerators in the world. And we may have been one of the first kind of pretty radical veterinary innovative companies that joined. But not only we were different on that angle, a different animal, let's say, but we were also, parents with toddlers, two of them 1 year apart. So we completely didn't fit. For anyone here who's heard anything about Y Combinator, it's very much, you think of like the hoodie, like couch surfing 25-year-old, and here we are like parents. And so it was really in the program is a lot of the evening. so yep, it did happen that we had to bring the babies here and there and be sitting over there and just here, take a video. Totally bad parents, the screen time thing. Now screen time won now after COVID. So nobody's, it's not such a big deal now. And, now they're 6 and 7, and they even talk about BRCA, like they say genes, they hear us talking. So they've been really part of it. They know our team, and they, with COVID and then there was homeschooling, imagine there's calls nonstop going on. And so they know about it. We work, just for the broader context, with really crushing cancer in dogs. We really want to turn things around in a pretty massive way. And, so we're very into enrolling patients, right? Like we need dogs with cancer, so we have the opportunity to help them with the best tools from human medicine, in specifically precision medicine. And so every day they ask me, how many dogs enrolled?
Oh, wow. That's so awesome.
Yeah, we kind of get into it. So we have a blast, actually. So they're very part of it. I don't know in the future what that means, but there was no way, when you have husband and wife co-founder, pretty, innovative company in a sector that has not had, you guys, I commend you for what you're doing here, because it's really important to bring innovation and accelerate it. It's not a sector that has had as much as I would like, so in every angle, it's if the kids weren't in, we couldn't do it.
It's so awesome. I've got a quick question for you. So it sounds like you've had your children help you develop your KPIs. What kind of KPIs do you guys manage or look at in your organization to know that you're moving the needle forward?
I mean, number one, which I just mentioned, right? Everything starts with the patient, because the type of development, clinical development we're trying to do, we're lifting a whole class of, access to therapeutics called targeted therapies, which have a great name because it's actually is what it is. It targets, the potential driver of cancer instead of chemo and radiation that zap, the bad cells, but the good ones too. So, and when we run a genomic test, a next gen sequencing panel to see, at a human CLIA lab, really top, to see what genomically is driving the cancer. So getting very efficient, very precise. Every dog is unique, and sadly, so is every cancer. So getting in there to really understand. And so number one KPI is patient enrollment, number one. So lots of folks, and these are just different companies, will do a beautiful lab, and, they're really into that in vitro world. We're in the in vivo all the way. We have friends developing interesting things, for example, in CAR T, very, very advanced and all of that. I'm like, I love it. Great. We'll help you however we can. But I'm more interested in that when it's ready to be off the shelf. Do you see what I mean? So we're very
Absolutely.
preoccupied with the last mile of care.
It's fascinating. And so I don't know if we really talked about what does your company do, because we just jumped in because I was fascinated with raising kids and starting the business. So let's take one step back and give sort of a quick explanation. What was the idea? Where did it take you? And where are you at right now? And who do you work with? Because I know that you have a fascinating team of specialists that are world class to get there. So what is it and who's on your team?
So first and foremost, 6 million dogs are diagnosed with cancer every year. And just for proportion, it's about 2 million people. So you can see here that this is pretty big and a huge unmet need. And that's like the stuff I love. I love that. Big problem, big unmet need. Moreover, we know that dogs as a species are used in R&D, in scientific like drug development. But as the bee goes, that type of thing. However, that species doesn't see any of the, doesn't sees very little of the advancements back. So we're part of closing that loop and also elevating the dog from a subject to really a patient. Really. And I think that goes in tandem with the trends probably you're seeing now of the dog not only being a best friend, but actually really a family member, right? So the dog as a patient is like the world we live in and we're interested in. And we basically, by offering, number one, access to this genomic test to understand what's driving cancer. And then number two, enabling access to those therapeutics that dogs have not really had access to before. And this is 10 of them, all FDA approved for humans. So safety, quality first. And again, because they've been tested in beagles, we were like, let's bring them back to the dog. We have an incredible scientific advisory board. I mean, world class, you couldn't be more, that have helped us very much design and kind of contemplate and specifically understand from number one, safety, what we could do. And so folks like Dr. Cheryl London at Tufts, she's just pioneer in the field, maybe the world leader when it comes to this kind of paradigm of veterinary medicine in oncology. And so she's helped us tremendously, because when you think of these therapeutics, you have to think, can it be combined with chemo or not? Can it be combined with another targeted therapy? Do I give it with food? 30 minutes after. I mean, all of this last mile of patient care, if you're interested in saving patients' lives, like that's the world you live in, and saving patients' lives like now. So we've been working on that, but just to back up, so we have a genomic test and then access to 10 therapeutics is kind of the bottom line. On the back of that, capturing this data, right? The journey of the dog that has a cancer diagnosis from diagnosis to death. And doing that as like a really, really, really top tech company would, like as much data with millions of data points, put it that way.
So I want to back up. I love how we've kind of like jumped way, way ahead. I want to back up even further, Christina. How did you get started? What's the origin story for this incredible organization?
That's great. Well, you guys kind of know my co-founder and life partner, Ben Lewis. So you may not know, or you may know that. So he went to Penn Vet. He did Wharton healthcare management, comes from a medical family. He was also a captain for the US in the Olympics for summer in kayaking and was going to go again for winter. So he's, holds his own. But he had an injury, actually. And in the injury, he ended up actually being in a wheelchair off and on for 2 years. He had to go back to school. He went back to Dartmouth College, which you can imagine is cold and icy. And can you imagine being in a wheelchair? I mean, that's like an event. And so he enrolled in a clinical trial for Genzyme that was doing, which at the time was pretty like very avant-garde, stem cell, like new technology to rebuild his leg. His leg had been just shattered, like almost hip down to ankle. And so, it really worked. He walks.
Wow.
It really worked. However, the drug wasn't approved, or the therapeutic, the modality was approved for osteoporotic postmenopausal women, and it failed at, what did we just say, the last mile of care. So he really like that really impacted him. So he's kind of like a patient as a founder. So he's very much patient centric when he's thinking of this. And concurrently, he had a dog that had cancer, enrolled in a clinical trial, and did really well. So there was like this parallel journeys, maybe not even concurrently, but like in parallel somehow. And they really inspired him to think, wait, there's something a bit off here, right? Human pharma is doing all of this and advancing and so many advancements, but there's something a bit broken in the development of the drugs, both at the animal model level. So in oncology, lots of drugs work in the animals, fail in humans. And then he was even going as far as thinking, wow, even at the clinical side, we need to do this better because, right, you want to serve those that it's intended to serve. So between all that, he really thought, let's do something. And also by, he was the kind of kid who wanted to be a vet at 2 years old, every year, I want to be a vet, I want to be a vet. So basically in that, navigating in that cosmos was like, wait, hold on. There's like a huge unmet need of cancer. Cancer kind of came to us. Like, we didn't wake up and think that. It came to us, and dogs specifically, because initially we were even thinking certain things with cats. But that whole came to us once we started like being in this more the research world, the R&D world. We quickly found out like, wow, there's an opportunity here in comparative oncology. It's the name of this field that compares across species cancer. And we thought, this is such a fascinating field. It's possibly the most underutilized kind of tool for like developing biopharma innovation. And we thought, there's no company capturing this. There's no spark. Like, people don't even know about it. So we thought, let's make it a mission. Let's bring this to the table. Let's help both sides of the leash, not as either or, but and. So that's the origin story. Initially, I was just a crasher going along for the ride. I like complicated, tough problems. One thing from my bio that maybe didn't show as much is I worked in emerging markets, whether I was doing, women's health or all sorts of things. I was always working with countries and populations that often were seen like not part of the zip code. So I was always bridging those worlds. I served on the board of Planned Parenthood as an advisor for the Western Hemisphere. And for example, cervical cancer is the highest in Bolivia, or one of the highest. And, there's like prevention, like there's actually a vaccine. So we helped bring that vaccine to Bolivia. So I'd already been in that world thinking like that. I used to say, I'm going to work with those that are marginalized and voiceless. I did not think the dog.
That's amazing.
So watch what you say, because it actually might come true verbatim. Dogs don't talk. I mean, they talk in their own, but not so really, I mean, in that sense, from that mission point of view, we're doing the work for those that we feel are very important, provide, so much to a family, and are vulnerable in this moment. Cancer is very vulnerable for the dog, right? It's aggressive. It's, tools need to improve.
So this is incredible, and I did not know about the injury actually with Ben, but what I did know is that he's not as other important and well-known leaders in this world. He's not a college dropout. He is an eternal student, as he claims he is. Did he ever graduate from vet school finally, or he's still an eternal student?
No.
So he's still an eternal student. Okay, I just wanted to verify that.
He got an MBA. We actually got that. He thought he had gotten it, and turned out he owed a fee, like a library fee.
What?
Almost didn't close around the financing because of that. We had to go back to Wharton and just figure, and it was one of those like,
and return a book to the library.
Like, it was crazy. Yeah. So he got an MBA. He has an MBA. So there you go. So I think he has very little left actually for vet school. It's mostly the like
I know, it's just he's always talking about that he's a student. Most conferences I've seen him at, he registers as a student. I think maybe now that the company is well funded, it's better.
Yeah,
it's better
I think
funded.
he get away with that. But yeah, no, and I think he definitely has that spirit of continuous learning, vision. I mean, that's definitely definitely him.
Fascinating. And so through, so I love both ends of the leash. And then the other thing is that, so the idea was that the way I remember Ben explained it to me, and I think you guys executed phenomenally on it, is basically there's all these studies that are done on dogs and other animals, but we have to simulate or induce certain diseases and, specifically cancer, to actually then treat it. And then here, you guys looked at the entire world of patients with existing cancer that developed naturally. You don't have to create a model on it. You just need to find them. And then another thing that I remember that was fascinating when I was talking to Ben is that you guys engage with the biggest referral hospitals in the country, looking for, the patients that you need with this early signs of cancer, because unfortunately, most dogs that start developing that cancer, they're euthanized before they get beyond the general practice. And I remember him telling me, and I'm a marketing geek, and I loved his idea. I don't know if you guys still do that, but then instead of looking through all the PIMS and terrible health records that are non-extractable from databases, he just started running ads on Google and with the ad campaigns on on hemangiosarcoma, and then people look for treatment for that, and you guys were sourcing your patients through it. Is that still what you do, or?
So we partner with mostly the oncologist community, because we really, you know what I mean? They're the ones seeing, the veterinary oncologists, they're the ones seeing cancer. And so that's been really the biggest go-to market. And we've worked now with 300 clinics, maybe more.
Oh, wow.
So that's been amazing. And indeed, absolutely. Pathway, all the big chains, all the very famous hospitals, AMC, New York City, some academic centers, Angel Memorial in Boston, so very prestigious. And, but then, no, you're hitting something where it's actually in COVID, it kind of was not out of control. It was amazing, but we had to literally build a team around it. We had 10,000 families call us last year.
Whoa.
And I think you hit also something else. When I say elevating the dog as a patient, I mean, on one hand, so the dog is not a subject in R&D, right? So getting rid of that hierarchy. So totally, another zone. But then at the veterinary clinic, also really the dog as a patient, in the sense of, which of course the dog is a patient, but really moving away from, of course, if, super end of life, hey, to each their own, that's a very tough decision. I hear you. But I can tell you from our experience that pet parents are very sensitized about cancer. They've had cancer, their parent had cancer, something doesn't add up in their head when, their golden is young and there's gotta be something more. They go and start finding the academic papers, the connections to human cancer. They do that. And then they come to us. So it's pretty wild. And I think this is like a citizen science kind of evolution. So what we've created, and we have an amazing team for that, a former actually Israeli captain that went to Stanford Business School, worked for Peter Thiel, and she's just rocks. And she has basically this way to really be able to, when a family is looking for help, to be able to match them to the best oncologists, veterinary oncologists in their area. And we do everything to we're like a Sherpa, we're there to help. We serve. Obviously we don't, we're not the clinician. So, the clinician has to do, decide this is the right thing, this is not. But we're there to very much help and be a guide in a moment of a lot of vulnerability.
So interesting. Christina, one thing that I think a lot of our guests will find fascinating is just kind of your guys' journey. So you have this big idea, you go to Y Combinator, and then what happens?
So we probably started it a little bit before Y Combinator, like most companies. When you're actually at Y Combinator, you realize Airbnb and whatnot, and all the, they at one time for the Democratic Convention were doing cereal for Obama in a box. That was how they funded themselves. So it's you hear these stories and they're very they sound at the end of the day so, oh yeah, they just crushed it, but they're actually pretty whimsical. So we started, Ben's been thinking about this legit for over 10 years, no doubt. I think he pitched it every year at his vet school. It was shot down, literally every year.
What do they think now about that?
Let's dial somebody into the podcast and ask.
Let's do it right now. Remember Ben Lewis that you didn't want to listen to?
So, no, there's definitely spiciness there. So basically, the first name of the company, everyone hated, but like everyone, and we were so proud. Look how out of it we were. It was called Ethical Animal Research. It was like everyone, people hated it for the word research. They hated it for the word ethical because then it makes people feel, oh, what am I unethical? Like it was actually like nuclear. Like it like bothered people massively. It was very weird. Yeah, so we had to change it, and we had no idea. We're like, oh, because I had studied actually ethics under Cornell West at Princeton, so I was like, oh, I love this. So basically, so Ben's been cooking this idea, not necessarily oncology, but this One Health. So we then named the company what it is, right? One Health is a movement, as you probably know, of really shared health and disease across species, and what can we learn? So we just named it the movement, end of story there. FidoCure is our go-to-market, is our precision medicine platform. We did come up with that at Y Combinator with some cohort mates. Like, let's pick a name, whiteboard. Okay, this is what it is. Let's go. And so basically, we started honing in on it. We were talking about it. We were actually in Sao Paulo in Brazil, where I'm from, when first moment when it became became like a deck. So it all started with a PowerPoint. Ben loves to make them. So there's like da, 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 da. And then we actually, with the little kids, moved back to the US partially to start the company. So the journey with the kids and the company is like cross countries, cross continents. And so basically we were in Philly, and actually the early Philly community was supportive initially, just some pre-seed money, the science center there, it's like between UPenn and Drexel. So we started doing things, and we partnered pretty soon with Eisai, the global pharma company. And just met the best people. What an incredible company. They had a really amazing drug that was made out of sea sponges in North Japan for metastatic breast cancer, and they wanted to interrogate in sarcomas, which dogs get a lot. And so we, embarked on a journey with them. So a lot of what came out, like FidoCure, birthed out of that, because we realized, oh my God, even when you have this pretty impressive budget to run a clinical trial, you can't enroll the patients. So meaning it's free, it's covered. We pay even for people like Uber, like thinking everything. In patient enrollment, this last mile is everything. You could have something fantastic, but if you cannot enroll the patient and deliver, and like it doesn't go anywhere. Think of COVID, right? The Moderna vaccine, printed in 5 minutes, and then to deploy it, right? Like you hit obstacles. So I'm very good at that, actually, because coming from more developing world, that's all you think about, right? Like, oh, is there refrigeration? Like, you think all these things. So I think in that we were very mindful and just had the luck to have such a great partner. That was really luck, I gotta say. That was really luck. And Eisai, the drug, we presented the data at very prestigious conference, AACR together, American Association for Cancer Research. And the indication moved on to Mass General. It's in the human clinic. Wow. This is like a remarkable story. Now it's Eisai's drug. We're not involved, right? But you can see how that, spurred us to think, okay, number one, we need to learn how to enroll patients, full stop. Otherwise, there's like, the motto of Y Combinators, do something people want. Like it has to have it there.
That makes sense. Yeah. We're running out of time. This always happens to us, but I do want, before our last two questions, to ask this question. So Ben had this idea for more than 10 years. You guys are happily married, have 2 kids, and then you're becoming the CEO of the company. So Ben is the COO, right? And you're the CEO. So you're technically hired by him. How does that interview is conducted at home? Like, is it at the dinner table? He goes, honey, I want to offer you a job. Like, how the hell does this happen? And what was it like? Like, how did he convince you to do this? And just what is the story behind that?
So we're co-founders. We're co-founders equally. Because I worked a lot in, bridging capital ideas and all of that, I fundraise in always unusual, eye clinics in Turkey. You know, like I always worked on the very, very kind of last mile.
Eye clinics in Turkey. You actually did that.
I did work in that.
We have another episode teeing up here.
So basically, I mean, I'm just saying, you know, like I'm from Brazil, and like so I've been working in these things. So I was CEO actually from the first day. Ben is really amazing at articulating the vision. You know, he's really that guy, and he does these very important. He brings people together. He sparks. He has a gravitas. But I definitely am more on the execution side. And, you know, there's a team you have to hire and fundraising and all that. I mean, he helps a lot and all of that. But that's kind of like my role. I don't get as involved. Now I do a bit more, but on the, you know, the veterinary product and all of that, he came up with the test and the drugs, the list, in 2 weeks.
Wow. That's so cool. Such an interesting story for an entrepreneurs as a family.
Yeah. And this paper that's coming out from this, you know, academic lab, it's showing that what he came up with in like kind of 5 minutes is.
Tell us about this. This is a big thing, right? This is the huge thing that's happening. Tell us about this this paper coming out.
So this paper is it's game changer for the space because it'll be the largest study ever looking at the similarities between canine cancer and human cancer. Okay, at the molecular genomic level. So basically, what is driving cancer, right? And the finding of the paper, the academic lab at University of Georgia Cancer Center, headed by Dr. Zhao. She's trained with Craig Venter, who decoded the human genome. I mean, just very, very, very top. She put her whole lab on this data set. And not only she validated that what we say is, you know, so when we say P53, it is P53, you know what I mean? Just like checking everything under the hood. But not only that, she's also validating this is the largest data set in the world. So we did it. And that our hypotheses, really, that the similarities, the biological relevancies are there. She's validating not only they're there, I think it's more. She called the data set beautiful to me the other day.
Aw, that's just like, out of all the words you could call it, is beautiful.
Yeah, I mean, academics say that it's a big deal, right? And this is all sprung from Ben's head, you know, not too long ago. So just to show you the power of innovation, right?
Yeah.
Here's a guy, right? He doesn't have a PhD. I mean, he's crazy smart. He did bio engineering undergrad, and like he comes from a medical family, you know, like he's super smart. But just to show you the power of innovation, like he didn't spend 20 years in a lab doing that. Do you understand? He was super smart, and we knew who to go to. We went to the head of Memorial Sloan Kettering. Like, let me just tell you that. Yeah, we're like, and I'm into that too. I go to Davos every year and World Economic Forum, all of that stuff. So we're like gonna go, I don't go middle of the way. We're gonna go for excellence all the way. So we found all the best people and worked backwards, right? And pulled it together. But it's just to show you that, you know, the story of Moderna with the COVID vaccine, I mean, you can kind of replicate, we are part of that model. We're a platform company. In fact, our largest shareholder, Andreessen Horowitz, is the mentee of the CEO of Moderna. So this is a movement. And what Ben did, and many of these other companies, it's showing, yeah, you can. This is the age of bio. No more of this, I'm going to do a bespoke kind of craftsmanship in a lab for, you know, 20 years and maybe it's going to work. Like, no, that's over. It's like, it's almost more engineering at the innovation level, not at the manufacturer, at the innovation level. So we're part of that, and it's a big thing.
Christina, this has been totally energizing and awesome. If people want to find out more, how do they do that?
FidoCure.com.
That was a very short answer. Thank you. And next question. If you had to recommend one book, something that's inspired you in your career that's taken you to this point, what would it be?
I love Ben Horowitz. I mean, they're, you know, our biggest backers. The Hard Things About Hard Things. I mean, that at the end of the day is where a lot of the, you know, day-to-day lies, is the execution, is really making the decisions, creating the culture. I think he's very preoccupied with the culture, and it's very important, actually. So I'm a huge fan of his. He has a new book, What You Do is What You Are. So kind of like the expression of who you are is in what you're doing. So that's more from the business side. Academically, my God, I have a library here. I'm like big fan of Hegel and Kierkegaard and all sorts of like all to do with like being and doing.
I'm like super angry that our podcasts are only 20 minutes now, Ivan. I don't know about you, but Ivan, go ahead, ask the last question.
Yeah, we'll. So the second question that we usually ask is there anyone in this industry that you think would be valuable to invite to this podcast and talk about innovation?
I would say Dr. Cheryl London at Tufts. She has a great TED Talk called "Of Mice and Men." So I love the title, and I think she's been really at the forefront. And she helped bring Palladia, the only targeted therapy available, FDA approved for dogs. So she's actually has a track record. She's involved in all sorts of cool things. She's an assistant dean at Tufts. But what's important about her is in a world that has a lot of silos, she's tearing them down and bringing people together. So she's really team-based medicine for real. And I would say that that's not everyone. And I think it's partially she's in Boston. She's very close to the Broad Institute. She's in the future. And I think that that's not a trivial matter when you're talking about a space that is small. You know what I mean? There can be those like kingdoms, like little. So she's kind of next level, and I'm a huge fan of hers. I think she could really say a lot of what she's seeing.
Thank you so much for listening to the Veterinary Innovation Podcast. If you want to hear about our new episodes, please follow us on any social media channel. Also, you can check out our website at veterinaryinnovationpodcast.com. See you next week.